Are you nervous about labor and delivery and wondering what you can do to prepare for the best labor experience of your life? Well, today I interviewed a labor and delivery nurse who also was a doula for 8 years prior to becoming a nurse. And I'm going to be sharing with you her 5 tips on how to have the best labor experience of your life. This is part 2. Let's go. If you're new to my community, my name is Josephine and I'm a registered nurse and also 32 weeks pregnant with our first child named Levi. We're super excited, and here on this channel I talk about the journey to pregnancy and motherhood and hopefully inspire you to be the best mom you can be. Now this is the second part of a 2-part series, so if you haven't seen the first part, you can watch this but then go back and watch part 1. I'm gonna have the link down in the description box below or right here. So tip number 1, having an induction or going for a scheduled induction is not necessarily a bad thing because you actually will be able to know your doctor and you'll be able to have peace of mind that not another doctor is going to be laboring you and your baby. They want to deliver their own patients. They've built a rapport with you. You've spent 9 months together and they know you the best and you know them the best. Now, if you don't get induced and say you do go into active labor, when your doctor's not on call, then you're going to have another doctor that's going to be delivering your baby. And that just causes a lot of stress on you, a lot of stress on your partner, because you just don't necessarily know the doctor who is going to be delivering your baby. Now, I will say that doctors tend to stay within their own practice. So more than likely, you will have seen one of the other doctors in the practice who may potentially be delivering you. Tip number 2 is understand the nurses are there for you to have a vaginal birth. The nurses and the hospitals have to meet a certain requirement as far as a number of vaginal births to keep their certifications. And so the idea that patients come in thinking nurses automatically want C-sections to happen is just not true. There is a protocol and a metrics that they have to follow to make sure that that doesn't happen. And so this preconceived idea that, my nurse just wanted me to have a C-section to hurry up and get along with labor, that's not true. One thing to do is just ask the nurse, how can I progress in my labor? She'll probably tell you, get a peanut ball, let's start moving you, let's change your positions every hour, every 2 hours. Majority of nurses who go into L&D, they want you to have a vaginal birth and they want you to have the best experience. So that just means partnering with them and speaking on what you would like, what you would not like, but being clear about it and partnering and collaborating with them to have the best experience possible. If you're getting value from this content, definitely make sure that you smash that like button and subscribe to my channel. Tip number 3, bring sticks of honey and hard candy to suck on. The hard candy helps with nausea when you start going into labor, and it also gives you energy, and the honey will actually sustain you to have more lasting energy, so when it's time to push, you're not completely exhausted. A clear liquid diet is the most practiced in most hospitals, but depending on your doctor and how you are presenting and how your labor is progressing will depend on if your doctor will order a clear liquid diet. And when I say clear liquid diet, that means anything that you can kind of see through, Jello, you can have juice, popsicles, ice, things of that nature. And one thing to note, if you are feeling a lack of energy, ask them, can I have a popsicle? Can I have juice? Can I have ice chips? And the worst I can say is no. Tip number 4, ask your nurse how to push if you are not sure how to push. Now this tends to happen a lot with those who have an epidural. You're not used to not feeling your legs and your lower pelvic floor. And so a lot of the times women just don't ask their nurses, how do I push? And I will guarantee you, nurses will be so willing and ready to help educate you on how to push. And if they don't, I'm going to share with you right now. So it's very similar to having a bowel movement. It's the same muscles that you bear down with when you have to poop. And so what you're going to expect to do is you're going to get into a position where you're curling and you're bearing down like you have to poop for 10 seconds. And this is where the collaboration and the team approach comes into play. You just need to recognize the position that you need to be in, and then your nurse will tell you when it's time for you to push. And this is the time for you to be yourself. If you need to grunt, if you need to scream, that's okay for you to do during this time. My friend told me that women tend to feel better when they grunt and when they push at the same time. Tip number 5, if you get an epidural and don't like how it makes you feel, you can tell your nurse to turn it off. Now, one of the things that your nurse will do is push down on your perineum, and you should be able to feel the pressure that she puts. Now, if you don't feel it, that may mean that your epidural is just a little bit too strong and you need to pull back on it. So the half-life of an epidural is about 30 minutes. And that means that it's gonna take 30 minutes for the medication to decrease in half. So it's not gonna be a quick, all of a sudden you're gonna feel the epidural stop. It's gonna be slowly over time and after 30 minutes, and the medication will be cut in half. Understand that an epidural won't completely wear off until 2 to 3 hours later. Remember, you are in control. So whether you like the epidural or not, you can actually tell your nurse, hey, can you turn it off or decrease the dose? It just is a little bit too strong for me. Let's turn it off for this amount of time, and then we'll go ahead and turn it back on again at this time. And a lot of times moms just want that initial pain relief that comes with the epidural so that they can sleep, they can get some rest, recoup some of that energy, so when pushing actually comes, they'll have the energy to actually efficiently and effectively push the baby out. And a lot of times this initial relief will allow your body to relax and allow your body to dilate. Sometimes women just are so tense from the pain that their body doesn't dilate and relax effectively, so they don't progress in their labor. So just remember, you are in control. Work with your nurse, because I can guarantee you she wants you to have the best experience in labor and delivery as well. Question of the day: if you've been a new mom and gone through labor and delivery, what are some tips that you would give that we didn't share today? Put them in the comments below. Thanks guys for watching, and remember, it's always a great day to grow. Remember your why, and whatever happens in your labor and delivery experience, as long as you come out with a healthy baby, that's all that matters. I hope you got value from this video, and I will see you next week. Bye.